Hi everybody, it's Dr. Sandy Cremers. I want to talk to you today about how to decrease inflammation on your eyes. If you're having pain, itching, burning, reflex tearing, redness, it's from inflammation. And so there are certain things that you can do to try to decrease inflammation. You've heard me talk about warm compresses if you can do it. Some people can't because they're too inflamed. They might have rosacea or skin conditions, and heat can make inflammation worse, in which case they can only put cold compresses. But heat is the only way we have at home to kind of milk the oil at the base of the eyelids, which produces meibum, which is an anti-inflammatory molecule that tries to help lubricate the surface of the eye and also decrease inflammation. So aside from that, warm compresses, I still recommend blinking, of course, trying to use your eyes for eye-worthy things. Don't look at me, just listen to me kind of thing. What else can you do? So drops are a big confusing category. What you should get, what you should try, it's very confusing because now we have many options. Over the counter, the only ones I would ever put in my eye are preservative-free artificial tears such as Refresh. There's hundreds of them now. Basically, they come in these little vials like this. I generally would take one out, pinch off the top, and then put it in an eye. The way you do it is you pull the eyelid down, just put it on the inside without touching the eyeball. I'm not a great eye dropper for myself. I will lean back or lie down and then put it in the corner and then let it drop in because I don't like drops. But this does work. It's not an anti-inflammatory, it's just trying to wash out the allergens and inflammation. Keeping it in the refrigerator, I highly recommend when it's preservative free because there's no preservative in that little container and there's more than one drop. So keep it in the fridge. Or if you are traveling the world and you already opened one, it's like insulin, keep it in a little thermos with ice, just like you would your insulin pack if you have insulin. So this does work. You can also buy these things on Amazon without using insulin. So anyway, that works. What is the next category? Well, we have FDA approved options to decrease inflammation. The inflammatory cascade is like a big monster. I tell patients we have cyclosporin to hit one side of the cascade or monster, and then lifitogras, which is Xiidra. And so cyclosporin was the first of its kind. I don't have a sample of Restasis, but Restasis is the first type. It's now generic. There's different formulations of cyclosporin. This is Sequa. There's one called Vivi that burns a little bit less. Some insurances will cover it, some insurances won't. Restasis generally takes about 3 months to kick in to diminish the inflammatory cascade enough that you notice an improvement. Sequa and Vivi about 3 to 4 weeks. Some people hate it, some people love it, sometimes it burns too much, but it's just trying to decrease one side of that inflammatory cascade. Lifitogras or Xiidra is another. Some patients will do both, the cyclosporin and the lifitogras, if it's enough, but insurances are pushing back more and more and not covering this. So that's when we will use your own platelet-rich plasma drops or autologous serum. We've also now tried to use cord blood serum and even stem cells to decrease inflammation. That kind of category is more obviously not FDA approved, more kind of investigational with an IRB we have here. And then if those don't work, we start to use steroids, which we really try to avoid. Steroids, like this is my favorite Lotemax preservative-free ointment because it's the only preservative-free steroid outside of a compounding pharmacy. This does work. The ointment can blur the vision, so we sometimes will only use it at nighttime. Drops can be used, but they have preservative. Lotemax and Predforte and FML and all the steroid drops are a very great way of kind of tamping down that inflammatory cascade, but it comes with a big risk of increased eye pressure if you're on it for more than 4 times a day, for more than 2 weeks, I should say. 4 times a day for 2 weeks, we have people come in to check out their eye pressure and increased risk of cataracts. So I'm a fan of avoiding steroids until absolutely needed. If you need it every other day or once in a while, you do what you can, and we take care of the cataract if it forms. But if you can avoid it by using your own platelet-rich plasma, if you have a benefit for that, I would definitely recommend trying to use your own serum or platelets or even platelet plasma-rich and growth factor, which we're now using to decrease the need for steroids. So I hope this video helped. Please pass it on. Please subscribe. That's how you can help me with the research we do here. Have a great day. Bye-bye.